of this station, its staff, management, or sponsors. Welcome to the Caregiver Reality Show, hosted by gerontologist and family caregiver expert David Levy, speaking on a topic that is not only a national problem, but an international one, and represents one of the biggest dilemmas facing us today: Alzheimer's disease and dementia. With no cure in sight and hundreds more being diagnosed weekly, Alzheimer's is more feared than cancer or heart disease. Join us as David Levy breaks it down and educates, informs, and explains useful caregiver strategies and techniques that 25 years of non-clinical family caregiving have taught him. You can listen or call in and be part of the show. 888-565-1470 to ask your questions. And now, here's David Levy.
Good evening, Boca Raton, America, and the world. This is David Levy, your gerontology caregiver on the Caregiver Reality Show. You can listen to us, or hopefully you're listening to us on WWNN 1470 AM, or you're watching us on caregiverreality.com. Just click on live show, and if you want to talk to us, it's 888-565-1470. We got a busy show tonight, and sitting across from me is my co-host, Paul Vattiato, and Catherine Huynh, who is the community liaison for Vitas Hospice Care. And Catherine, welcome. Paul, as always.
Thank you for having us.
And, it's a pleasure, because people have so many questions about what is hospice all about, and I just can't wait for you to take the myth and the mystery out of it. So we got a few pieces of business to take care of first, and this is Caregiver Reality. We're a little science, a little human interest, a little caregiver education, and we are support, respect, and everything that we can do to educate the family caregiver. I want to remind you that coming up in the next few weeks, on the 6th, the 13th, and the 22nd of November, will be Brain Boosters. It will be at Temple Shalom next to Century Village on Lyons Road in Boca Raton. All you have to do is give Arden Court a phone call, 561-498-5552. You register once, you register for all three. There'll be door prizes handed out at 12 noon. You need to be there to do it. And there are some phenomenal speakers coming up. On the 6th, Paul, is a really good speaker. We have Dr. Mark Brody from Brain Matters talking about the brain, and he is followed by that exquisite speaker who I always love to listen to, David Levy, gerontologist. I'll be following Mark Brody right after his performance, and we've been doing a lot of tag team speaking these days, and he is a pleasure to listen to, and a great person to be able to follow. David. Yeah, he is a smart guy. When you were gone last week, Paul, one of the things I had mentioned was that we were beginning to do some business in the Caribbean, and some folks asked what was that all about. And so what I'm telling you is there's a call to action in the Caribbean, because the Foundation for Alzheimer's Awareness is having its launch brunch event to be held on Sunday, November 10th, 2013, and it's at the South County Civic Center on Jog Road. And it's to start a whole new initiative regarding Alzheimer's in the Caribbean, and for people of Caribbean descent who are here in the United States. They have a tremendous amount of Alzheimer's and family caregiving, and they really don't have a very well organized way of approaching it. And so many of the officials in the countries in the Caribbean, Tobago, Trinidad, Barbados, St. Lucia, etc., have gotten together and created this organization. I'm going to be helping them to educate and teach. We'll probably be doing it by Skype, or we'll be doing it through Freddie and broadcasting it via internet into the various countries. And I hope that. What I really want to let you know is that we're looking forward to seeing everybody at that November 10th brunch. Please give Janice John, who has got it organized, a call at 561-543-2373. That's 561-543-2373. 2373, and that's to begin to accelerate an Alzheimer's initiative in the Caribbean and to support folks of Caribbean descent here in the United States. Paul, I was talking to you earlier when we were sitting outside, and I was getting fuming and furious.
Yes.
All right, and why don't you touch back on what we were discussing? All right, just as a way of leading into this, I always tell you, if you don't hear it here, don't believe it, and that the world is full of sound bites that say one thing, and then when you go in and do a little deep diving, they mean something else entirely. And today I read an article that was published in the Journal of Epidemiology that said family caregivers live longer than their peers. And I said, what? In all my 25 years of doing this and being around family caregivers, looking at the stress, looking at the discomfort, at the health forgetfulness that caregivers go through because they're worried so much about their loved one they don't take care of themselves. Never have I seen it written or said, and especially not by way of survey, that being an active caregiver, especially for somebody with dementia, is actually healthy for you. And so, Paul, why don't you pick it up from there?
Well, it's just such an unbelievable concept. And then they had the audacity in the article of saying the finding is somewhat of a surprise. Wow, all these years, the stresses of caregiving, so much evidence to the contrary showing that it has such a difficult effect on people, and now a survey saying that, oh no, you're all wrong, it actually is very, very beneficial and actually helps you live longer.
Well, I don't think they said very, very beneficial, but they certainly alluded to that fact.
Yeah,
right?
They implied it.
And this came out of a 2003 to 2012 study that was called the Reasons for Geographic and Racial Differences in Stroke. All right, the program was called REACH. And from that, they extrapolated out a small portion of the study that had to do, for the most part, with rural Southerners, black and white. And from this, they made some astounding leaps of faith, even in the face of all of the information that we have. Paul, why don't you pick it up from there?
I want, if I may, David, just to read a little from the article. It says, of the 3,503 caregivers included in the study, over 80% said they were experiencing either no mental or emotional strain or only a moderate level of such strain. Only 578, or less than 1 in 5, felt that caregiving caused them high strain.
I find that amazing. One thing I will tell you, when I was getting my degree in gerontology, I had the pleasure of studying under a PhD at FAU by the name of Dr. Elizabeth Jett, who got her PhD doing studies from rural black communities about caregiving. And she said one of the most elusive things in those kinds of communities is finding the caregiver, because there's something called a fictive kin, which is just what it sounds like, a fictitious kin. There's an auntie, a cousin, somebody else. So you don't even know when you ask the question about caregiving who you're really going to find out who that individual is. The same thing happens to be with white Southerners in Alabama, Mississippi, and I'm not casting aspersions on any of them, but if you got into a discussion, and this was a survey where you had to self-select, meaning you had to decide you were a caregiver and then respond. Most people haven't got the vaguest idea what a caregiver is.
But let me continue on, David,
please,
because it just gets more amazing. It says roughly 2/3 of the caregivers were female. Okay. That's normal. About 1/3 were adult children, and about 1 in 5 were spouses. Slightly more than half provided less than 14 hours a week.
All right. So that's not I mean, that may be a caregiver, but that's 2 hours a day or 4 hours on a Saturday and Sunday and an hour during the week, if. And this is remembering when they ask you, do you do caregiving 5 to 10 hours a week, 10 to 15, 15 to 20, more than 20? So you can't call yourself a caregiver and say, well, I did 5 to 10.
All right, and here's where it really gets a little bit more astounding. Regardless of the nature of their responsibilities, caregivers appear to reap benefits from their own selflessness. Death rates were 18% lower among caregivers than among their non-caregiving counterparts, Roth and his team reported.
Yeah, well, I think, so the point I'm making, and Catherine, when we get to you in just a moment, although if you have a comment about this, please chime in. In your experience with hospice, have you ever seen a caregiver? Now, true, it's end of life, but have you ever seen a caregiver that wasn't stressed or burned out or just taking it all like it was a walk in the park?
This is an unfortunate kind of article because it doesn't really give the breadth of what caregivers do and what their responsibilities are, and as well as the stress put on caregivers. It doesn't really show
And so they
accurately.
carved out a little piece of something, and these folks wanted to get their headlines so they could get into one of the journals, and anybody that sees this has to say to themselves, are these people nuts? And I'm the one saying it right now. Because the thing that I found very interesting, Paul, were the two ending quotes out of it. The one that said, the narrow focus on only African American and white adults limits generalizing it. Well, of course it does when we have such a large Hispanic and Asian population that isn't even counted in here. And the other great quote was, we have no idea whether these findings may apply to other races, cultures, or ethnicities, which is like saying, we came up with a bunch of nonsense and now we're disclaiming it to make sure that nobody can attack our study.
Well, surprisingly, what I looked for and did not find was who paid for the funding for this study.
I have no idea. I tried to find it. They would not let me download it from the Journal of Epidemiology to find out who may have been a sponsor. I do know that it was done out of Johns Hopkins University by some social scientists, a reputable institution, but I certainly think that this is really pandering to the press. And I think you can make statistics say whatever you'd like them to, and I think this is a classic example.
And what is the agenda?
Yeah, well, I don't know what the agenda is, except to say that caregivers don't have the stress and the discomfort level that we've all seen and experienced. I think that's nonsense. I do say that maybe there is some spirituality and resilience that they exhibit that may let some of them not be as sick as others or get as stressed out. But I think that's a huge leap of faith to take a small group like that and then make such a broad-based generalization. So, folks, I'm telling you, if you read the article, Family Caregivers Live Longer Than Their Peers, take it not with a grain of salt, but with a 50-pound bag that you use in your water softener, because that's a bunch of hooey. And since if you didn't hear it here, you wouldn't have heard it. And I'm telling you, there's very little to no validity to this study.
For those of us who are caregivers, it really is offensive.
It is. And since you and I are both caregivers, Catherine, you were a caregiver for your father, it really is offensive. Because it makes it sound like what's wrong with us, and not only that, but Paul, when was the last time, whether it's your dad, your wife, my wife, when was the last time we only put in 14 hours a week in caregiving?
It's more like a day.
Yeah, exactly. It's more like 24 in 7 at a minimum. So all I have to say is, folks, don't believe what you read until you hear it here, because we did our homework and this is a bunch of nonsense. Anyway, we're going to take a break, and when we come back, we're going to listen and hear from Catherine Huynh, who is going to be able to tell us some of the things that we all wonder about from hospice, kind of get rid of the myth and the mystery, because everybody has their own version of what it's all about. And if you'd like to, after we speak with Catherine for a little while, call and ask a question, 888-565-1470, or on WWNN 1470 AM and on caregiverreality.com live show.
Hello, are you a family caregiver? Are you taking care of a spouse, parent, or loved one who can no longer care for themselves? Are you dealing with Alzheimer's disease and don't know what to do? Are you stressed, burned out, frustrated, and don't know where to turn? Have you realized that your doctor, lawyer, and mental health professionals don't have real practical answers? You need a non-clinical family caregiver expert that the professionals turn to. You need David Levy. He is a family caregiver expert with 25 years of active experience with thousands of family caregivers. He can help you provide a better quality of life for you and your loved one. Contact David Levy at dlevy@caregivered.org. That's dlevy@caregivered.org. Or call 561-482-0086. And let's get your mental road to healing started.
All right, well, we're back, and this is the Caregiver Reality Show. We're on caregiverreality.com. Just click on Live Show, and you're listening to us on WWNN 1470 AM. And you can call us here at 888-565-1470. My guest tonight is Catherine Hind, who is Community Liaison from Vitas Hospice Care in Palm Beach. And welcome.
Thank you so much.
All right. And I understand that before you got started with hospice care in Palm Beach, you were with hospice care of the Treasure Coast?
Treasure Coast Hospice in Martin in St. Lucie County.
And you were there for 7 years?
Yes.
All right. And what led you into hospice care?
Well, as we were talking earlier, you find your passion in many ways. And for me, hospice is something I stumbled upon. My father was sick 10 years ago. Mm-hmm. And just like all American families, we were all scattered throughout the United States. At the time, I was Washington, D.C. All of our siblings were everywhere. California, Ohio, Oklahoma, and also Lakeland, Florida, which is also another country. Right. But you know what? We had to deal with it just like all families. What do we do when someone gets sick? And so I have to thank my husband, because he and I decided we're going to move back to Florida and we're going to help take care of him. So,
wow.
And he had hospice for only 4 days. And with those 4 days, they gave us the confidence to know what we were doing to help him was the best that we could do at his end of life. And so I stumbled upon hospice, and I stumbled upon Treasure Coast Hospice through that time in our lives.
All right. And then what did it take in order for you to become part of the organization? What kind of training did you go through?
You know, I am actually a social worker by trade. Mm-hmm. So I, having been a social worker, it's now understanding what hospice means and what does end of life mean. Mm-hmm. And understanding that I had to feel comfortable working with people who are going through death and dying, and not only the patient, but the family.
Right.
And of course, having that been so close and personal to me, I had to understand, how do I then help others who are going through the same thing I had gone through.
And so, in a nutshell,
yep.
All right, and I know that this is a large amount of territory to cover, but exactly what is hospice? I mean, I know what the word means and where it came from, but how would you describe the activities of hospice?
Hospice is about providing comfort care at a person's life where they no longer have a cure for their medical illness. So an individual who has a terminal condition, who has a life expectancy or prognosis of 6 months or less, they qualify for hospice. And so it's a specialty in providing end-of-life care or comfort care.
All right, and so we call them in. Most people call in hospice usually a little too late.
Yeah,
and
you know
don't
what?
take
You're
advantage
right.
of the fact that the family can use the support earlier on than just maybe the pain management and
That's right.
the removal of some of the intervening medications and
Right.
other things that our loved one may have been
Very
on.
good statement. So 2 points. Yes, they call too late. Like my situation, if I had hospice in for my father, that meant he would have been more comfortable sooner. So we are getting that referral from physicians late in the game, where people could have qualified their last 6 months of life. We're getting people at their last days or weeks of life. So that's one part. The second part is, you're right, it's not only the patient, but the family. How do you support the people who are going through a different kind of journey? The caregiving aspect of it, making sure they are also emotionally supported. So there's a very complex and very vulnerable time for both the patient and the family.
When you first get a phone call, all right, whether it's from the doctor, whether it's from the family, you go out and evaluate the patient, and at that particular point in time, are you also doing a family evaluation?
Certainly.
What are you looking for in terms of the family? Are you looking to
Right.
see who's the alpha caregiver? Who do you have to deal with first?
Well,
or-
you know what? Each person is so unique. So yes, we will go in when a physician calls, but we also will go in when families ask us to.
That
So
I
know
know,
that
and
I want to
I think
empower
that's great.
our community to call in themselves. That's one piece. So our nurse actually will evaluate and see where that person is in their disease process. You are looking at a healthcare continuum.
Right.
They may or may not qualify for hospice at that time. So depending on their disease, depending on how far their disease process has gone, they will either say, yes, you look like you're eligible for hospice at this time, and we can either contact your physician or have you sign on to hospice care, or they will say, you know what, you may be a little too soon. So chances are it'll be more the first, because again, we have that late referral.
Paul?
Catherine, it seems to be a general notion that hospice is basically for the elderly. And that really isn't the case, is it?
It isn't. In fact, it's, again, one of those myths that we always have to re-educate our community about. It's really anyone who has a serious illness, one that's progressive and one that's terminal. I've had, in my experience, had to help a patient that was 16 months old. And what we did was we helped the family in caring for that child, as well as his siblings, and making sure they're also supported in knowing what's going on. So really, there's no age limit, or on the other end, there's no, you could be from 0 to however,
Right.
as long as it
You
qualifies.
raise a very important point. In some of my caregiving, I get involved with children,
Yeah.
and I know how difficult it is for their siblings, because they always feel guilty that they had some responsibility, similar to a child that's going through his parents' divorce
Right.
and thinks that it's their fault for some reason. And especially when you have a 16-month-old, where you might also have children who are 4, 6, and 8.
That's exactly
and
what
all
happened in
they
that
know
case.
is that their brother is sick, and they have no concept of death and dying. How do you begin to approach children like that?
You know, I actually, in that case that we had, that 16-month-old, when we did our very first visit, the nurse helped the parents take care of the medical needs, and my focus was the 4 and 6-year-old that was in the home. I sat on the ground with them, played with them, and talked to them about what they thought was happening. And in that situation, in that home, they said that they knew their brother was sick, and that he was probably going to go to heaven. So in their situation, they were kind of versed in what was going on, and we help people where they are. We recognize that some people need a little bit more help, but that's emotional support. And in fact, the parents kept coming in and saying, okay, well, is everything all right? And I said, yes, it's fine. They just couldn't believe the two were so sitting quietly with me because we were reading a book, because we were helping kids.
A, you're very good at what you do, and B, you understood how to
Yeah.
approach a very difficult subject
Yeah.
with very young children. So you provide, Vitas actually provides the care. The bulk of your care is provided at home. Is that
It's
correct?
really wherever the person lives. So if they live in their own home, private home, or if they live in an assisted living facility, in a nursing home, or in the hospital, we go wherever the patient lives. And frankly, that's the difference. What we want to do is recognize that people have the choice. If they are living at home, we'll provide the services where they are. That's another myth. People always thought that you had to go somewhere.
Right, and you can stay home.
You
Do you
can stay
find that
home.
people are uncomfortable having hospice provided in the home versus doing it in
You know
an
what?
external location?
When you're sick, where do you want to be?
Home.
I want to be in my own home. I want to be in my own surroundings.
I want my jammies and my snuggies.
All over that. And so, no, I don't think people are comfortable. They're most comfortable in their own home. 9 out of 10 people want to be at home.
Right. You know, we were just discussing a moment or two ago the fact that even doctors call in hospice too late.
Yeah.
Is it because doctors are always out to try and heal the patient and don't want to give up until there's absolutely
There
nothing
may be,
more to go?
that's one layer that maybe the physician isn't referring, but maybe they are, but the family is not ready.
Okay.
So there are so many layers to this, and a lot of it is how do we get out there and communicate and educate
Right.
our community about what hospice is and that hospice is a healthcare option.
All right. And if somebody who's listening in tonight and who is in the Palm Beach area, what number would they call to be able to at least contact hospice and find out if their
Sure.
loved one may qualify or what?
Right. They can call 1-800-93-VITAS. That's VITAS. And usually I like the numbers more than the acronym, but it's 800-938-4827.
All right. Do you have a website?
Yes, we do, and it's VITAS, VITAS.com.
Okay. Now,
Catherine, when they call,
Yeah.
how do they begin that conversation on the phone?
You know, truly, it's about the kind of questions they may have at that time. It could be some people are worried about maybe what does that mean? What does hospice mean? Or their question may be, I'm not really sure if my loved one qualifies. So they start with that kind of question that is burning. That's what they want. Everyone's different. So we want to address their concerns.
right. You know, as a mediator, and I was discussing this a little bit last week, is that I'll get families that will come in that are making a hospice decision.
Yeah.
And we'll get one child not child, but adult children for that matter, who will say, no, you can't stop doing everything, you're killing daddy. And I'm sure that you encounter that with
Certainly.
families as well. How do you approach that?
The way I deal with it, a lot of it is based on, again, my own personal experience. I had that. I was asking my siblings, I think it's time to call hospice. And they were saying, no, we are not ready. And I would say, you know what? It's not about us. It's about our loved one. And in our case, it was our father.
Right.
And is it too soon to give him comfort? And the focus is his health care and his own quality of life.
Right.
So when you put it in those terms, who is it about?
Right.
Then it's an easier answer.
All right. And I've always found when I get into it in mediation that I turn around and say to the family member that may still be, having difficulty coming to grips with it, it is about them and not about you. And do you think your father has any independence laying there in bed with all those tubes hooked up?
Right.
All right. Is there any quality of life? If you can answer yes, then maybe we'll have a different conversation, but rarely can they do that. And I said, do you think your father has any sense of dignity like this? And so isn't it better to let him go than to continue on with certain heroics when everybody on the medical side has determined that there's nothing more that can be done?
And furthermore, again, in our situation, I asked my siblings first, but what I should have done was ask my dad.
Yeah.
He knew what he wanted, and he's the one who said yes.
Did he
to
have
hospice.
advanced directives?
I had to talk to him about it.
Oh, okay.
So it
Well,
was
see, if he'd had advanced
tough.
directives, possibly, it would have made that conversation easier for everybody.
You're right about that.
All right. And so that's why I tell everybody that I'm involved with, you need a durable power of attorney and advanced directives so you don't leave this to the family to decide at a very stressful time. I see we're getting near station break time, so this would be a good time to take that station break. If you'd like to speak to Catherine, you want to talk to Paul or me, we're 888-565-1470 and caregiverreality.com, or you're listening to us on WWNN 1470 AM, and Catherine will be here with Paul and me after the break.
Talk 1470 WWNN Pompano Beach, WKIS HD3 Boca Raton, Miami, Fort Lauderdale.
Hello, are you a family caregiver? Are you taking care of a spouse, parent, or loved one who can no longer care for themselves? Are you dealing with Alzheimer's disease and don't know what to do? Are you stressed, burned out, frustrated, and don't know where to turn? Have you realized that your doctor, lawyer, and mental health professionals don't have real practical answers? You need a non-clinical family caregiver expert that the professionals turn to. You need David Levy. He is a family caregiver expert with 25 years of active experience with thousands of family caregivers. He can help you provide a better quality of life for you and your loved one. Contact David Levy at dlevy@caregivered.org. That's dlevy@caregivered.org. Or call 561-482-0086. And let's get your mental road to healing started.
Well, we're back at the Caregiver Reality Show, and we're talking with Catherine Huynh and Paul Vattiato, who's my co-host. Catherine is community relations or community liaison for VITAS, which is hospice of the which has hospice in the Palm Beaches. Excuse me, not to be confused with. And there are a number of other hospice organizations within the county. How does one go about choosing? I mean, what turns hospice up, whether it's one or the other?
Sure.
Is it prior experience? Is it who serves the community best? What is it?
Well, I think it's about patient choice. You just like most, we are all consumers, right? And we are all consumers of healthcare. We have to interview the hospice providers and find which one you connect with. As a person that works for VITAS Innovative Hospice Care, the difference really is for us, we recognize people want to be cared for at home. We have one inpatient unit. It's in West Palm Hospital. And I will tell you, it's because we know most people want to be at home for services. So that to me is a big factor in deciding which hospice to call.
Well, in an aging America with so much dementia and chronic illness, I was doing a report because this weekend I was telling you outside I have to go out to Austin, Texas and have a good taco. But I am one of the speakers for Aon Hewitt for the American Society of Healthcare Risk Managers, the folks that decide what your premium ought to be and what risks the insurance companies are going to take. And I think this is a fascinating subject. I think people stay away from it because it sounds like it always comes it does come at a time of passing, but yet what we're trying to do, because end of life is no different than beginning of life or during life. You want to do it in the best way possible, with the best quality, with the least amount of pain and discomfort. And I think doing it at home, because everybody is going to wind up back at home. We just don't have the facilities. There's only 1.5 million nursing home beds in this whole country. And I was checking today, there's under 1 million hospital beds, and not that we would necessarily do hospice in a hospital, but when you start to add up, and about 2.7 million assisted living beds, not all of which are designed for chronic care, and most is designed for independent and to some degree assisted living with activities of daily living, and not, I recognize that any of those environments can have VITAS. Let me ask you this. When you call VITAS, what does it cost?
The call and the evaluation is free, but as far as hospice itself, hospice is a Medicare benefit. So individuals that have Medicare, it is paid for 100%. But for those who don't have Medicare, we also take Medicaid, private insurance, and another differentiating factor for us as Vitas, we actually provide care to anybody who's eligible, regardless of their ability to pay. So we, in the last year, provided $10 million alone in charity care. So
Wow.
for those who are eligible and they don't have the ability to pay, Vitas would not deny care for them.
Wow.
Yeah.
That's really something.
Quite a statement.
Yeah, and especially in this community alone, $10
Yeah.
million. I have no idea what the average what
That's
is
for
the
national.
all right. But what is the average cost? Do you have any idea
The
of what a
aver-
typical hospice?
Like on their site, you know what? That's a hard question to answer. I
Okay,
don't
then
have that data.
I'll retract it.
But I can tell you though, if you want to compare,
Right.
all hospices, like say in Palm Beach County, get the same rate. We're regulated by the same organizations. So in that sense, we have the equal footing
Right.
as far as standards of care.
Well, I know that you're a private organization,
Yes.
and so is that part of why you are able to provide
Yes,
charitable care?
Yeah, actually, in 1978, we started as a nonprofit, but then we recognized that in order to grow the hospice philosophy, we needed to raise money and be able to provide care throughout the country. Now Vitas is a national leader and is in 19 states. So
Wow.
beside Palm Beach County as well as Broward and Miami, we're in 19 states.
Okay.
Catherine, if
Go
I
ahead.
just to
Yeah.
clarify, when you mentioned Medicare
Yeah.
as the payer of the services, does that also include those that have selected an advantage type of Medicare as well?
That's right. I mean, regardless of what program or plan they choose, hospice is a Medicare benefit.
We talked a little bit earlier, and even though you don't specifically offer, but would you explain for the audience what palliative care is?
Sure. And actually, palliative care is really about comfort measures. So if you think about an individual who's got a lot of pain, well, on top of, they really have to manage that pain, but then you really have to figure out, okay, what along with pain management do you have to take care of? Your body slows down, that means you have to have other type of adjunctive treatments. So palliative care means comfort care. And that's an easy way of thinking about it. How do you consider that really hospice is a specialty? Our physicians specialize in pain management or palliative care.
Okay. Well, that makes good sense.
If I may,
Yes.
Catherine, I lost my dad in January of this year, and Vitas was an integral part of his last, I'd say, 12 to 14 months of life. And as the adult child caregiver, he was in assisted living at the time. It is just amazing as to the compassion, the quality of care, 24/7 weekends. It really didn't make a difference. Whatever was needed, it really was provided for my dad. And I was so impressed with the communication that they gave to the family. And even after my dad passed, we continually got calls regarding bereavement. And I don't think many people are aware that this type of care continues even after, in my case, Dad passed away.
Right. Well, first I want to, I'm sorry for your loss.
Thank you.
But you're right in that not only do we provide hospice care, we also help families with bereavement services more than a year after a person dies. So that support is part of our services, whether it's one-on-one grief counseling or group. So depending on really what you choose. But you're right, we would stay in contact and make sure that you're doing okay.
Right. Now, my situation was that my dad was put in hospital. It wasn't Vitas at the time. This was many, many years ago. And they actually threw him out because he was getting better.
Yeah. And that is the scenario. Think about the fact that all human beings are complex. We believe that a person is declining, but then there may be individuals that kind of stabilize. We are regulated and we're scrutinized all the time, right? As far as the healthcare industry.
Right.
So hospice is the same. Our teams have to ensure that every individual is eligible. There are times where people graduate from hospice because they do stabilize.
And that's what happened to us. And
Yeah.
I think, but the one great benefit
Yeah.
of my dad going from the hospital to hospice is you folks took him off of all of his meds. And once we got rid of the polypharmacy, and 11 different medications,
Right.
he thrived.
Yeah.
He went on for another 6 months before I had to call hospice back, because this time it was for real.
Yeah.
But I had more of a lucid time with my dad where we could really communicate, where with all that medication beforehand, we just couldn't do it.
Right.
Catherine, it has been absolutely
Thank
fascinating. You really bring the perspective that I've been looking to bring to our audience about hospice care and what you do at Vitas. Would you please give that number again?
Sure.
Whether you give it in numbers or names.
I'll do both. 800-93-VITAS. That's 1-800-938-4827, or the website, vitas.com.
Okay. Last question. If you had to sum up your feelings about hospice care and what you do, what would you say?
I would say call when you really believe it's time for help. No time is, your time is really the most important. Your time, like you said, with our fathers, all three of us, I guess that's our bond. And recognizing that is the time you can spend together, full of quality, comfort, dignity, and respect. And that's what hospice is about.
Thank you. Thank you
Thank
very
you,
much.
Catherine.
I hope you'll stay for a few extra minutes.
Yes.
All right. We'll be... That number is 888-565-1470. I'm not hearing the phone ring, so I guess we must have you all entranced this evening and have answered all your questions in advance. And when we come back after the next break, it's going to be the next in the series of Dr. David Hilfiker, the doctor from Washington, D.C., who has Alzheimer's and who has been blogging about it. And tonight's blog is called Is It Always My Fault? So we'll go to the break, we'll come right back, and you're listening to us on WWNN 1470 AM.
Hello. Are you a family caregiver? Are you taking care of a spouse, parent, or loved one who can no longer care for themselves? Are you dealing with Alzheimer's disease and don't know what to do? Are you stressed, burned out, frustrated, and don't know where to turn? Have you realized that your doctor, lawyer, and mental health professionals don't have real practical answers? You need a non-clinical family caregiver expert that the professionals turn to. You need David Levy. He is a family caregiver expert with 25 years of active experience with thousands of family caregivers. He can help you provide a better quality of life for you and your loved one. Contact David Levy at dlevy@caregivered.org. That's dlevy@caregivered.org. Or call 561-482-0086. And let's get your mental road to healing started.
Well, we're back, and it's Caregiver Reality, and I'm here with Catherine Huynh and Paul Vattiato, my co-host. This is David Levy, and right now we're about to do the 7th in the series of blog recreations from Dr. David Hilfiker. As I said before the break, he's the doctor from Washington, D.C., who has Alzheimer's and has been blogging about it a few times a week. I can notice in his blogs a little bit of decline from where it was much earlier in the summer when we first started to track him and when we had him on the air. And that just could be my subjective trying to determine between the written word. But tonight, and as I always do, I can't say it better than Dr. Hilfiker, so I read. All right, and he says, and this one is entitled, it was from the 10th of October, Is It Always My Fault? I'm having more of those good day, bad day experiences. Monday evening, I met with a Gettysburg College class on homelessness that had come to Washington for some direct contact with poverty. In preparation, they'd read Not All of Us Are Saints, my book of stories about my providing care to the poor in Washington. I give them a brief lecture on the origins of poverty in the inner city, and they had lots of questions. After an hour and a half, the students were flagging a bit, but I decided to tell them about my Alzheimer's. That seemed to re-energize everyone, and we had a good discussion. Once again, I had no trouble in a small group setting. It was rewarding for me and, I think, helpful for them. I was gratified. Then I came home to discover another of my screw-ups. We've been trying to get rid of bed bugs in our apartment. Long story. The last time we'd used the vacuum cleaner was to suck up any lingering critters. Marcia, my wife, had wanted to throw out the vacuum bag so that all the bugs swept up wouldn't escape back into the apartment. But I decided we would just take off the bag, seal it in plastic, and reuse it the next time. Then I stored it in its usual place inside the vacuum cleaner without even a note anywhere to remind us of what I'd done. Monday, Marcia had spent much of the day scouring the apartment to get rid of the bugs, including a fair amount of vacuuming. When I came home, I took over, only to eventually discover the disconnected, sealed-up bag. We both spent a long time vacuuming with a machine that sucked things up but then leaked them back over again. Unfortunately, I didn't remember anything about what I'd done with the bag, so I blamed Marcia. She naturally blamed me. After a little bit of the typical husband-wife back and forth, I felt angry, and I blurted out, "So anything that happens is now automatically my fault." Only gradually did I begin to remember and recognize it was indeed my fault. It was humiliating. But given my Alzheimer's, when something ridiculous happens and neither of us knows why, doesn't it make sense to assume that I was responsible? Occasionally, of course, it may be Marcia's fault. Her memory isn't perfect either. But by far the likeliest candidate is going to be me. That's just the reality, and that means I have to come to terms with it. I would like to get to the place where I can, even in the moment, acknowledge that I've probably done whatever ridiculous thing that had just happened. I would like to get to the place where I don't feel defensive or humiliated. I would like to get, and perhaps both Marcia and I can get to the place where we don't need to waste emotional energy pinning down who did what. Perhaps we can get to the place together where we even laugh at the ridiculousness, if it is, in fact, funny. And he ends with, "I think we can get there, but it'll take work on both of our parts." This was a blog from Dr. Hilfiker where he didn't really express any great amounts of difficulty with his Alzheimer's as he has in the past. But it's just interesting to see that he can still conduct those small group meetings and that people sit and listen to him. And I think that he rises to the occasion. And he raised a very interesting point a couple of weeks back, saying, is there another category of dementia called mild cognitive impairment that you don't really move away from, even though my doctor says I don't have Alzheimer's, but all the researchers say I do? And I found that with the medical profession myself, doctors, general practitioners, I'm not talking about neurologists, are very reluctant to use the word Alzheimer's. And now that we refer to it as Alzheimer's and related dementia, I wonder whether or not doctors have difficulty still in coming up and using the word dementia. I mean, Alzheimer's was like Kleenex. It was a general description for everything, and we threw everything that was forgetfulness into that category. But I'm wondering, Paul, Catherine, whether or not we have come to a point in time that the medical profession thinks they understand more about the disease, even though Alzheimer's is the most prevalent form, then followed by temporal frontal lobe dementia, and possibly another category called mild cognitive impairment. But then there are 47 other varieties of dementia. So do we really know, and are we doing everybody a disservice? I know one category of individuals we're doing a disservice to. When you read your long-term care insurance policy, it specifically says Alzheimer's and not dementia, along with 2 activities of daily living trigger the utilization of that policy. And you have to wonder why all of a sudden, and I'm not saying that the doctors are in cahoots with long-term care, but back at a a day and age 20, 30 years ago when most of these policies were being sold at a very heavy clip, they only knew from Alzheimer's. And so right now, many people that have different forms of dementia find that even though they've been paying for all these years to have a long-term care policy when exactly this kind of thing arises, but they don't have Alzheimer's. They have one of the other 49 varieties. And
I think that's the two-edged sword, though. I mean, more and more awareness is occurring. There's a lot more that's being written and spoken about the various forms of dementia. But the other side of that coin is those differentiations that make a world of difference when you're trying to collect on a benefit.
yeah. And you must see a bit of end-of-life dementia, or
Yes.
is it dementia as a complicating factor to end-of-life chronic care?
The sad thing is for individuals who have Alzheimer's, it's just or dementia related. Their physical being actually is not that bad, but it's really just the fact that they have cognitive impairment. But at end of life, they are individuals that are at their end of life. They're individuals who may be in bedbound, who are can't maybe eat on their own. They need someone to help them. Can't walk on their own. They need someone to help them do that as well.
Well, it is brain degeneration,
Yes.
and at some point that degeneration will affect our ability,
Physical,
our autonomic
sure.
nervous system, breathing, eating, blinking, no matter
Yeah.
what it may be. But, we've always considered Alzheimer's to be good body, bad brain, as opposed to many other heart disease, stroke, cancer, bad body, good brain. And that's why sometimes the most difficult kind of caregiving is dementia, when the loved one that you're caring for no longer recognizes you, can no longer communicate with you, and yet they do have the physical ability to live for many more years. Matter of fact, I was reading in the MetLife statistical tables not too long ago that both Parkinson's and Alzheimer's patients at the time of diagnosis still have the ability to live out their full actuarial life. And when we stop to think about that, that's when we begin to understand where all of the dementia care has got to go home. We have 10 million just between temporal frontal lobe and Alzheimer's and probably Parkinson's if we don't count serious mild cognitive impairment, and we just don't have the place to put them. So from my side of the equation, educating the caregiver, and part of educating the caregiver in my family caregiver practical problem solving manual, one of the things that I let people know is to call in hospice early, because especially if you're dealing with near end of life with a dementia patient, you can use all of the help, all of the insight that it's possible to kind of round up, and it's going to get tougher and tougher. And unfortunately, there's nothing on the horizon that looks like it's going to be a breakthrough for any of these forms of dementia. So we had better get ready as a country, and that's what my theme is for the healthcare risk managers. And if they want to understand who was the canary in the coal mine to first spot it, long-term care insurance. They went out of business because they couldn't afford to pay for it, and those that are still around, like the MetLifes, have gotten out of the business because actuarially there's no way to predict what dementia and aging as a combination are really going to amount to. They can have folks that have a lifetime policy, 10, 12 years of getting home care or getting facility care, and if there's no cap on it, I mean, how many multi-million-dollar policies can you afford to fund? And so that's one of the big enigmas in this country. And as we look at healthcare moving forward, one of the big difficulties is going to be, where will it take place? We know it will take place at home. Who will educate the caregiver? So far, very few people have stepped up to the plate. Hospice has done a wonderful job in educating the caregiver when it's their segment of time. But long before its end of life, we have families that are dealing with not the nonsense of family caregivers live longer than their peers. Family caregivers, especially those who suffer from dementia, put up with excruciating difficulty, trying to understand, trying to control their own emotions. And I can tell you, because I do a lot of family caregiving and support groups, that it is still the case that caregivers predecease their loved ones
Right.
due to the stress and their own health element. I was at a funeral last week for a good caregiver that had been with me for 3 or 4 years. Husband is still in a facility, and she had a stroke, and then she passed away, and the stroke was directly related to all of the stress, the high blood pressure, and she finally threw a blood clot, and that was the end of that. So we in America are certainly going to need, and I'm just, I don't have enough time to really ask you, but I would have to imagine with the growth in aging and with the growth in chronic illness, that you must really have to be gearing up in personnel to be able to handle the amount of calls and then the utilization of those people out in the field.
There are still so many barriers for people to access hospice that in time, I hope we meet the need. But for me, in my role, it's still how do we get past the emotional decision in going to accept hospice in the home. So that's where we're still at right now for me,
Well,
and the
that's
work that I
part
have
of
to do every
educating
day.
the family,
Yes.
wouldn't you say, Paul?
Yeah, and that's a discussion that happens earlier than later.
Yes.
And as they're doing their advanced directives,
I agree
that's
with
the
that.
time to start having this discussion. How do I want my
Right. How
life to
do
look like?
I want my end of life to go? Where do I want it if I have a choice?
Sure.
And I want I want an expert. Just the same way I want an expert.
That's
If I
right.
break a leg, I want an orthopedic surgeon. If I have cancer, I want an oncologist. If I'm at the end of my life, I want the end of life specialist coming in to take care of me,
That's right.
lending their insight, providing their expertise, and making what can be a difficult situation just a little bit easier.
Right.
And Catherine, what you do is just wonderful.
Thank you.
And I tip my hat to you and your organization, and for that matter, all of the hospice organizations. Without them, we would really be floundering.
Thank you. And November is National Hospice Month.
Oh.
As simple as that sounds, it means that we're just still trying to get the word out. How do we get people to know about hospice? What's the best way of educating our community and recognizing that hospice is a community resource?
Yes, it is. And because everybody that's born will pass.
That's right.
And if you want to do it with dignity and with quality of end of life, then you certainly want to be in a position to call in the experts and call them in a timely manner.
That's right.
So thank you again for being here.
Thank you for having
taking
me.
some of the myth and the mystery out of it. Paul, always a pleasure to have
Thank you, David.
All right, and we'll be back next week. You've been listening to Caregiver Reality out on caregiverreality.com live show and WWNN 1470 AM. Remember, we're here not because it's our mission, because it's our passion. And so, good night, Boca, America, and the world. It's been a pleasure being here, and I hope you got some useful information out of Catherine and Paul, and that Dr. Hilfiker, his blog. Next week's, I've already read it, is really fascinating, so I look forward to presenting it to you.
You have been listening and watching David Levy